Welcome to In Depth with Academia. I'm Richard Price, your host today. It's so incredible to delve into these academic papers and explore the curiosities they unravel, isn't it? Today, we're looking at a piece by Wiku Andonotopo and his team from Indonesia University. Hugh, I'm always impressed by the dedication and intricate work that people out there put into understanding complex issues like pre-eclampsia. So let's dive right into it. What exactly are we talking about today? The paper, formally titled Difference Between Vascularization Indexes of the Placenta in Severe Preeclampsia and Normal Pregnancy by Three-Dimensional Power Doppler Ultrasound, addresses a crucial question. How does severe preeclampsia, a serious pregnancy complication, impact the vascular makeup of the placenta? And why should we care, you might wonder? Well, here's a thought. Preeclampsia is not only a leading cause of maternal and fetal mortality, but also a condition that's shrouded in mystery. We don't completely understand its origins or mechanisms, so every piece of research like this means potential advancements in maternal health. Let's consider the core question here. What differences in the placenta's vascularization can be seen in severe preeclampsia compared to normal pregnancies? That's a mouthful, but it's essentially about understanding if there's something peculiar with blood flow in complicated pregnancies that might provide clues for early diagnosis or treatment. Now, how did Wiku and his team tackle this problem? They used a technique called three-dimensional power Doppler ultrasound, a fancy term for a method that creates detailed images of blood flow. By analyzing these images, the researchers can quantify the placenta's vascular nature. They took their sample from 80 pregnant women, 40 with severe preeclampsia and 40 with normal pregnancies, and examined the vascularization index, flow index, and vascular flow index of their placentas. You know, it's like taking a 3D picture of a tree to see how the branches and leaves interact, if that makes any sense. Now, the paper reports some interesting findings. One of the standout insights is how all the three 3D power Doppler indices, vascularization index, flow index, and vascular flow index, showed significant relationships with gestational age. What does that mean? It means these measures can potentially signal changes as pregnancies progress, or regress rather, in cases of preeclampsia. Digressing for a moment, did you know that preeclampsia really puzzles not only doctors, but expectant mothers too? It's one of those diagnoses that can be quite frightening because it's just so unpredictable. Okay, back on track. Using these indices, they noticed particular patterns. For instance, the vascularization index had a dispersion pattern and then reached a plateau around week 30 of pregnancy. Afterwards, it began to decrease, indicating something was quite different towards the end of the pregnancy. Did you catch that? With this data, the authors suggest that 3D power Doppler ultrasound can indeed evaluate blood flow in the placenta more accurately than conventional methods, which is a game changer for fetal monitoring. This means, theoretically, please note, this is presented neutrally. It could better monitor pregnancies, catch preeclampsia's onset earlier, and possibly improve outcomes for both the mother and the baby. It's important to mention, I am neutral here, after all, that academic research isn't the gospel truth. It's like stepping stones on a longer journey. Today's findings add a piece to the puzzle, not concluding it, but as more studies like this align and deepen, we may indeed be on track to better combat pregnancy complications like preeclampsia. Isn't it just fascinating how advancements in technology, like ultrasound, have advanced our understanding of things? I sometimes wonder, if this technology existed decades earlier, what a difference it could have made. But then, we've come a long way, haven't we? This paper leaves us with several open-ended questions. How can these findings be practically applied in clinics? Could earlier detection lead directly to better outcomes? Can these kinds of indices become standard practice? Well, they're questions for another day. For more research, more discussion. And we've reached the end of this episode. If you enjoyed this deep dive into the world of academic research, I'd love to hear from you. Until next time, stay curious and keep exploring the depth of academia with me, Richard Price. Take care.